If you have Parkinson's disease and you are seeing things that are not there, typically vivid hallucinations, this video is for you. I will tell you 4 recommendations in steps in less than 5 minutes. My name is Dr. Zayas. I'm a neurologist specialized in Parkinson's disease and other movement disorders. First of all, you need to establish to make the difference between acute or chronic. If you just started having visual hallucinations out of the blue, it is completely a new symptoms. Before blaming Parkinson's disease by itself or the medication that you take for Parkinson for months, for years, you need to make sure that you rule out, number one, infections or electrolyte disturbance. When I say infection, could be even a UTI, urinary tract infection. Also, make sure that you are not dehydrated or having some type of electrolyte disturbance. In other words, if acute, you call your primary care physician, and your primary care physician will evaluate and probably will run some labs to make sure that you don't have an infection or electrolyte disturbance. If there is no infection or electrolyte disturbance, or any new medication during the last week, then you can blame Parkinson's disease or the medication that you take to treat Parkinson's disease, especially after 1 month having these issues. Then what? The next step is to evaluate yourself. You need to ask yourself, are these hallucinations bothering you in any way, affecting your function? If the answer is yes, then you treat. If the answer is no, you don't need to do anything about it. You don't need to treat every single symptoms in Parkinson's disease. Only if the symptoms is affecting your function, your daily activities. Now, if your hallucinations are bothering you, are affecting you, then you follow these 4 steps. Let me start with step number 1. Step number 1 is to check your vision and your hearing. Very important. Step number 2, you need to simplify your medication regimen. Instead of adding more medication to treat hallucinations, why you don't maybe decrease or eliminate medication that you might not need? And I will put the order of the medication that you should consider stopping. This is the order, will be in the screen. Step number 3, which is, if you have dementia, try rivastigmine or donepezil or galantamine. These are medications that might help to decrease hallucinations, especially in the setting of dementia and Parkinson's disease. Step number 4, and the last one, if you have moderate or severe hallucinations or no improvement after 2 months of treating all the things that we discussed already, then you need to try medication for that, specifically for that. My first step, my first choice, and this is because of the cost, and it's easy for patients to get this medication, is Seroquel, which is quetiapine. You start with 25 milligrams at night and you increase progressively by 25 or even by 12.5. Number 2, if that doesn't work, after 2 or 3 weeks, you give a chance of 2 or 3 weeks, then you try the only medication approved by FDA to treat psychosis in the setting of Parkinson's disease, and the name is pimavanserin. You will see the name in the screen, pimavanserin, or the commercial, the brand name is Nuplazid. The key here is don't give up. You need to wait at least 2 months because this medication takes time to work. So remember, wait at least 2 months before stopping this medication or saying that this medication is not doing anything for you. Number 3, if no improvement after trying Nuplazid, then you need to try clozapine, which is the very effective but require a blood test, a CBC, every week, especially during the first 6 months of the treatment. If you like this video, don't forget to subscribe to my channel. See you soon.